Ice or heat? Which is best to use when you have pain or trauma? Hi, this is Dr. Steve Goodstein, chiropractor and applied kinesiologist. That is a very common question I get asked, and often one that confuses many people as to what is the right answer. So today, let's clear up some of that confusion. So to best understand, the best way to use ice or heat modality is to understand how they work. So if we look at ice, ice works by doing what's called vasoconstriction. That means it narrows the blood vessels in your body in that region. And by narrowing the blood vessels, you reduce blood flow and circulation to that area. So that makes ice great in the application of inflammation or swelling. So for example, if you fall on your elbow and it swells, you put an ice pack on. You stub your toe, or you acutely strain a muscle or injure a joint, then you want to put an ice pack on there to reduce the swelling. Heat, on the other hand, does the opposite. It increases blood flow to an area, what's called vasodilation, and that increases circulation. And when do you want that? After the swelling goes down, you want to bring blood flow to an area to help the area to heal quicker. And also, it helps reduce the sense of achiness and helps with spasms as well. And it's good for stiffness and joint pain. So that's when you want to use heat. In terms of application of the two, either ice or heat, 20 to 30 minutes is fine. Put an ice pack on the area or heat, whichever is indicated. Use it for 20, 30 minutes, take it off for about an hour, and then you can reapply it and do it as often as you want until you get the desired result. So I want to finish with 3 tips that I'll give you regarding ice and heat. Tip number 1, if the area is sharp, knife-like, or burning, then I would use ice. Try ice first. If the area is dull, achy, tight, or stiff, then I would use heat. Tip number 2 is, if when in doubt, use ice. If you're not sure which one to use, put an ice pack on the area, because you can do no damage with an ice pack. Heat, on the other hand, can increase circulation, inflammation, and make it worse and slow healing time down. Tip number 3 is use moist heat instead of dry heat. That's because dry heat only heats the skin superficially. Moist heat dilates the pores in the skin and allows the heat to penetrate deeper into the muscle tissue. So I hope that today's presentation answered some questions you might have had about the application of ice and heat. But I would love to hear any comments or suggestions that you may have. And at the end of this presentation, you will see my contact information. Also, feel free to share this with family and friends. And until next time, be well and stay well.